I'm Dr. Lydia Caldwell. I'm an assistant professor in the Department of Kinesiology here at the University of North Texas, core exercise physiology faculty. And my research interest here really is in studying recovery for both mental and physical performance. So we are so lucky here at the University of North Texas to have a state-of-the-art float room. We are one of the only colleges in the country that has a float tank. You may have heard this referred to as flotation-restricted environmental stimulation therapy, or just float or float therapy. The tank itself, fiberglass shell filled with about a foot of water. But what's unique about this water is that it's also filled with 1,500 pounds of Epsom salt. What that salt does is it increases the density of the water, allowing the body to float effortlessly on the surface. This leaves the eyes, nose, and mouth out of the water for breathing naturally. During a session, we also reduce the lights, reduce the sound, and really give the body and mind a chance to have reduced input to the brain. What we're really interested in looking at with this technique is what happens at the level of the brain. What happens when we reduce all these external sensory inputs? So we're looking at heart rate variability, blood pressure, cortisol, catecholamines, all these physical markers of stress. But in addition to that, we want to know about mental load, fatigue, energy, the way you sleep. While the float happens independently, on the other side of this space, we have our control room. This is where the investigator can monitor the session. So we can look at things like heart rate variability while the individual is in the float. This space is also used for all of our pre and post measurements.